Today, we are going to talk about solution-focused family therapy. In our series of reviewing um, all the kinds of therapy, this is one of the therapies which can be tested in the test and also exam, and also in your clinical life. You can refer somebody to this also. So the emphasis of this is on strengths, possibilities, future focused solution rather than dwelling on the problems. So, as the name suggests, solution focused, you're focusing on solutions, not problems. You're building on family strengths and what has been worked in the past, emphasizes on small, achievable steps. So, let's say focusing on solutions. You know, traditional therapies often spend considerable time on analyzing problems and how they came about and all that. But solution based now shifts the lens to what can be done to create positive change. By focusing on solutions, the therapy energizes clients and avoids the fatigue of dwelling on challenges. And then you have somebody who is building on family strengths and what has worked in the past. Every family has its own set of resources and strategies that have brought them through tough times. So we ask family to reflect on these strengths and past successes and allow them to see how they can leverage this tool to current challenges, and emphasizes on small achievable steps. Change doesn't happen drastic and overwhelming. It's an incremental process. So you need to celebrate small victories to create larger transformation. So like key techniques which are using is miracle questions. So miracle questions is, think about imagine walking up tomorrow and all your problems are vanished. What would your ideal day look like? This technique encourages the client to picture their best case scenario. It opens a door to positive thinking and allows families to identify what they truly desire in their lives or in relationship. So, miracle question is part of solution focused family therapy, and you want to know about it. Then, exception finding questions. In this, here's where we look at moments when things were better by identifying times when issue was absent or less severe. Families can uncover the circumstances, behaviors, and dynamics that contribute to those positive moments. Now, scaling questions. To measure progress, clients are asked to rate their current situations or feelings on a scale of 1 to 10. This not only helps in tracking improvements, but also prompts a conversation about what can be done to move on step higher on the scale. For example, if a family member rates their stress as 4, what would it take to reach to 5? Improvements wise, things like that. So the focus of what strategies have been effective in the past, applying successful behaviors and solutions in future, build upon existing strengths, and reinforcing positive changes. So things like remember miracle question, think about exception finding questions, and scaling questions. Like somebody says that they are at 4, what would we need to do to get to 8 or something? So I hope this helps. Review the video if you need to. Thank you very much.